to meet Clifton.
Here's Ray. Hi, everybody. Thank you, and welcome to Meet Clifton. Tonight we have another fabulous show. We have a lot of interesting guests. We want to get started as soon as possible. I'd like to thank everyone for tuning in. So, of course, my co-host George Silva is here with me tonight.
Sure, you forgot.
Thank you, George. I think the memo was black suits.
Yes, it was tonight.
That's okay. I'm not wearing the hat, though. So let's just forget the hat. Okay. Okay, thanks a lot. Stay tuned. We'll be right back. But in the meantime, listen to a few songs from the Two Tones. Okay, welcome everyone to tonight's show. The City of Clifton just finished their community health assessment through the Health Department. It's an assessment about the city. We'll get to that in a second, but I want to welcome my first two guests, Jennifer Kidd, the Health Projects Coordinator of Clifton Health Department, and Melanie Shefchik, Instructional Specialist, Department of Public Health from Montclair State University. Welcome, ladies. Thanks for coming on.
Thanks for having us.
Like I said, they just finished the community health assessment, so we'll just let Jen start explaining what it's all about.
Good. So a community health assessment describes the health status of the community. It involves gathering data and community perceptions from a variety of sources to identify the key health needs and resources within the city. The Clifton Health Department conducted a community health assessment to identify current and emerging health issues, to provide this information to the community and our local partners, and to set the foundation for future programs, services, and grants.
Okay, now, I'm looking at this too. I don't know if we could get a close-up on that eventually, but we'll put it at the end. For Passaic County, what kind of data, because I know this is based on data, what kind of data did we gather for this?
So in Clifton, we were really lucky in that we had access to a variety of different data sources that we could incorporate into the health assessment. Given our population size, the City of Clifton was included in something called the 500 Cities Project, and that gave U.S. cities in the United States that had over 66,000 residents with access to a variety of different data through an online dashboard called City Health Dashboard. So we were able to examine 37 different health-related measures and then make comparisons about those measures to these other 500 cities. And in some cases, we had data at the census tract level, so we were able to look within the City of Clifton and see if there were any variations neighborhood to neighborhood, which was really helpful. We also got data from our state health department and from our local police department, but we still felt like that wasn't enough. We wanted a very comprehensive assessment, and so we did an additional measures to reach out to our residents and get information from them regarding their concerns and perceptions around health. So that included 9 focus groups with 80 residents, 14 key informant interviews with different community leaders throughout the city. We also collected 376 community voice surveys. And then we also completed something called a built environment assessment for the whole city, and that was done with my students at Montclair State University. So they went out to each of the city's 16 census tracts and examined them in terms of their physical structure. So they looked at sidewalks, they looked at crosswalks, they looked at what food access people have in their neighborhoods and made some determinations based on that. And then the last thing we did was we worked with our stakeholders to examine the public health system and the healthcare system and see how well those things are working together to meet the needs of the community.
And I'm looking at my questions, and you just stated some of the important findings, but what were the primary health concerns identified? Because we're talking health.
Right. So through the data that was collected and the assessments that Melanie just listed that we conducted as a health department, there were about 12 themes that emerged from the community health assessment. Limited access to services, neighborhood safety, which included both traffic and pedestrian safety, as well as crime and violence, affordable housing and homelessness, environmental health, obesity, including nutrition and physical activity, lack of health care and health insurance, cancer, maternal and infant health, mental health, drug and alcohol abuse, education, and we also saw some variations in the value that was placed on ethnic and cultural diversity in the community.
Right.
So those were the emerging themes.
And I went through this, and as far as safety goes, in the top 500, I know we're way up there as far as violent crimes, not up as far as having them low in crimes, that we're rated one of the better cities in the top 500 in the country. Which is really good to know, because we always think Clifton is so great, which it is. Now Now, compared to other communities, what areas does Clifton do exceptionally well?
So according to that City Health Dashboard and looking at the average of all those 500 cities that were included in that project, Clifton did really well and is doing better on a whole bunch of different measures. So some of them include our high school graduation rates, absenteeism in schools, income inequality, our violent crime rate, as you just stated, right? Racial and ethnic diversity, children living in poverty, unemployment rates, neighborhood racial and ethnic segregation, park access and walkability, as well as access to healthy food. So we found that people had access to lots of recreational opportunities and all the things that they need very close by, which is wonderful. Lower levels of binge drinking, smoking, mental and physical distress, our opioid overdose death rate, cardiovascular disease death rate, diabetes, obesity, life expectancy, premature death, and dental care. So quite a number of things. I think they're showing them for you on the television that Clifton performed better than the other 500 cities.
Which is great. So it just proves once again how great Clifton is. And actually, I'm looking at this. This snapshot thing is great.
Yes, that's a snapshot of the
And hope we can
community
put that
health
up because
assessment.
even I'm looking here, people living below poverty level, 70% in the county, 9% in Clifton, and through the whole state of New Jersey, which is 10, we're pretty low. So I think we're doing well. But now that this is complete, okay, this is the CHA.
Yes.
So now, what, where do we go with this after this? How does the city use this for information?
Right. So the Community Health Assessment, or CHA, as we call it in public health, is essentially a blueprint for our newly formed Steps to a Healthier Clifton Coalition. We're going to use the Community Health Assessment to develop what we call a Community Health Improvement Plan, or a CHIP, and also an internal strategic plan for the health department. The CHA will also help us attain national voluntary accreditation. And then other agencies that we work with in the community can use the CHA as a data source and can also use it to help guide their work.
Right, which is really good. Now that's the coalition. I'm not too clear on this.
So the Steps to a Healthier Clifton Coalition is a newly formed coalition that's being spearheaded by the Clifton Health Department, and it has representation from various community organizations and agencies that serve Clifton. They are working together to share resources and to try to address some of these identified health areas that Jennifer spoke about a minute ago. So they're really going to be tasked with creating this community health improvement plan, implementing it, and focusing on specific action plans that are going to help Clifton to become a healthier place for people to live, work, and play.
This is great. Everyone should really, if they have a chance to read this, there's so much information there, education, age, household income, everything. But obviously, we can't go through this all today. So how do they go about, like the residents at home
Right,
or
sure.
anyone interested?
So a copy of the Community Health Assessment is posted on the Health Department's website. If you go to the city's website at cliftonnj.com and .org, and go to the Human Services tab, under there is the Health Division, and on the left-hand side of the page, you can find the Community Health Assessment, as well as the snapshot summary of the Community Health Assessment. You can also find, there's a link to it on our Facebook page. Our social media handle is Clifton Health. Or you can request an electronic copy by emailing me at jkid@cliftonnj.org. Again, that's jkid@cliftonnj.org. We can get an electronic copy to everybody.
Thank you for coming on and share this. This is real. I can't say enough about this. I went through this. It's fantastic. You learn so much about the city. I think if people really want to know what's going on, everything from where stores are located, it's a lot of information. So,
There is.
please contact Jen or get a copy. You'll be really surprised how great the city really is. Thank you again for coming on. Appreciate it.
Thank
you.
you.
We'll be right back. Okay, welcome back, and thanks for tuning in. I have two special guests with us tonight, and we have all of these things about America and how great it is, and our military that serves. So tonight I have two special guests, Sergeant Roberto Guzman and Staff Sergeant Joel Nunez. So welcome for coming on the show.
Thank
I
you for having
appreciate it. We're going to talk a little bit about the Marines and why you joined and the college programs. But let me ask, First, let me ask you, why did you join the Marines?
Well, I joined the Marine Corps, sir, because I felt like I had a duty to serve my country. Also, I tried going to college and I couldn't afford it. I saw my brothers had joined prior to me, and I saw the benefits that the Marine Corps gave to my brothers,
Okay.
allowing them to get their bachelor's degree.
Great. And you, sir?
I joined because I didn't feel like I was being fulfilled in regular college life. I wasn't giving back, and I felt it was my turn to give back and actually be part of something bigger than actually what I was doing in life.
Right.
So I felt.
I guess let me just find out what you both do. So your job in the Marine Corps.
So my job in the Marine Corps is in 0311. So my military occupational specialty is an infantryman for the Marine Corps. So what we do in the Marine Corps is just we train and we're always prepared for whenever the nation needs us.
Okay. And I'm a 7051, which is kind of like a code for that we have, and I'm a firefighter. The long-term name for it is Aircraft Rescue Firefighter Specialist. So I'm pretty much trained in structural, and I'm also trained in aircraft too as well.
Okay, and maybe I'm jumping ahead of myself, but one of the questions was, what job the Marine Corps do that a lot of people don't know, and I'm finding out.
Yes.
You
So,
could-
yes, I'm pretty much a regular firefighter. That's the way I see it. But we're specialized and trained with aircraft. So, God forbid, the aircraft goes down, we put the fire out, strike the pilot, and perform, CPR to get them from there to the hospital. And we have certifications, the same thing, like I said, as a civilian firefighter.
So if you when you came out, if you wanted to join a fire company, paid fire company, would you have to go for training again, or are you pretty much certified?
That depends on the state, but usually it's mandated. Like the bank, like you're good, you have your experience, you can go on and become pretty much like where you walk on and get hired on right away.
Okay,
Yes,
so
sir.
I want to touch on the college because a lot of people, don't know that you could go to college. So maybe if you want to touch on that, the college, can you go to college while you're serving, and how does that work? I'm not
Absolutely. So for myself, I've been going to college since I joined the Marine Corps. For me, the way that it's worked for me is online. So I go 3 hours a day, Friday, Saturday, and Sunday, and I go at the University of Phoenix in Arizona. And that allows me to catch up while I'm still working full-time active duty.
Right. So did you join the Marines first, or you started college first?
No, I joined the Marines first because they pay 100% of my school. So
Right.
I've been going for a little bit over 4 years now, and I haven't had to spend a single cent of my money.
Which is good incentive.
Yes,
I
it
guess.
is.
And I guess, did you join the Marines
For
first?
no, so I went to college first, like I said, one semester. The environment that I was in, it wasn't really conducive to what my head was at. So I wasn't satisfied. I wasn't feeling passionate what I was doing. So I called my local recruiter, and I'm here 8 years now. I've been here for 8 years, and started going to college now again, finding out a bachelor's degree. And I went for free. I didn't have to pay a dime. Still paying the student debt off that I was initially paid 8 years ago. But I'm happy that I got my degree finally now.
So let me ask you, can you get your degree, whatever it is, BA or whatever, will they still pay for higher education, master's, doctorate?
Absolutely.
Yes.
So once you've done your 4 years of honorable service, you decide to get out, the Marine Corps will continue paying for your school. And since you already done your 4 years of honorable service, as long as you're going full-time, you'll rate it extra benefits as them paying for your housing and your food and electricity and all that, all bills.
So let me ask, since you're both sergeants, how long have you been in?
I've been in a little bit under 7 years.
7 years,
And 8.5.
8.5 years.
Yes. Yes, sir.
Career, or sorry, George, go ahead.
No, finish up. You finish up.
At this point, yes, to be honest with you, I've been in for 8 years. I'm 30 years old, so I can retire at 39, 40 years old if I want to. I just still think it's pretty young, if you ask me.
Yeah, absolutely.
I can go on and still continue my firefighting career or branch out from there, see what I want to do, and go from there.
What's the benefits for a high school student joining up with the Marines with tuition, of course, and other benefits for them for the future?
So for the future, I would say the experience he's going to get in the Marine Corps. A lot of jobs that are hiring right now, even if you show up with your bachelor's degree, will not hire you unless you have some experience. The Marine Corps will help you get that experience in a related field and help you get that bachelor's with zero cost to you. So you come out with your education and your experience, and now you have two avenues of approach to get the job that you've always wanted.
And
So
then-
the student wouldn't be paying anything,
No.
no percentage or anything?
Absolutely
They
nothing.
go in, and they go in for what, a couple months, at the beginning?
Yes.
And they can go to school then?
So we're talking about is about reserve a little
Yeah,
bit.
something-
Yeah. So
something
active
like
duty
that
is
too.
what myself and Sergeant Guzman are.
Right.
Reserve is pretty much a part-time. So it is 1 week in the month and then 2 weeks in the summer. So if they want to come back here, become a local firefighter or police officer, they can. They can still continue their regular life. All they got to do is to just check in with their unit, stay sharp on their craft, and go from
And
there.
they can go to college too?
Yes.
And
Absolutely.
get paid by
Yes, sir.
United
Absolutely.
States government?
Absolutely.
So being, obviously, you're now recruiters for a while. I guess
Yes.
you moved the jobs around. So someone walks in and they say, listen, Jay, I want to go to college, but I want to join the Marines. How do you answer that question? Because I'm sure you're going to get that.
Oh, yeah.
We say perfect. All we want to do is, what that individual's looking for is the reserve. So the reserve, they have maybe a choice of their university they want to go, maybe a local one.
Right.
All we tell them is that we're going to help them get there. All they would have to do is go to 3 months of a boot camp training.
Right.
And then as soon as they're done with training, they go to their school. When they finish their school in the Marine Corps, then they come right back and they can start attending their university of choice.
Right, but after all this is done, can they enlist as a regular
Absolutely.
Marine?
Yes. After
You know,
2 years,
From
they can,
reserve, you can go from reserve to
Yes.
Marine.
Yes.
So after
Reserve
2
to
years,
active.
they can transfer from reserve to active.
Right, so that, I guess that's a good deal.
You can
Plus,
get both of a taste of both worlds.
I guess if you want to go to college, college is pretty expensive if the government is
is.
going to pay for it.
It
And I'm
is.
sure as recruiters, that's probably a big question, right?
It is. It
Absolutely.
is.
Or to at least learn like you're in as a fireman.
Mhm.
A lot of people don't know that, so that's great because when you get out and you're going to retire at 39, and that's incredible.
Yeah.
Um,
Yes, sir.
And the last question I just want to ask is, I have it here. How much does the GI Bill pay for college?
It is about $90K, so $9,000 for per the 4 years of school, and then they can go on, and that doesn't include the book fees that they have to, the stipends and housing. What I mean by housing is that so say they want to go to school in California, they'll pay for the rent over there,
Right.
and then like say they live with a roommate, they can also split half the rent, and the rest goes money to them. So instead of being the way I see it is like instead of being a regular college kid, going in debt for 20 grand a year, they can
it's expensive.
they can afford like roommate with somebody and kind of go from there too as well and have their own money to to actually live a little bit.
Right, no, absolutely.
Mhm.
And I just on the recruiter thing, because I guess your recruit office is going to be in Clifton at some point. Do people come off the street and just walk in and say, or you solicit them from high schools? I'm just curious, because you're going to have an office, would people just walk by and say, want to join?
Absolutely. They always walk in the office. They want to get information, and we give them the information they want. And if they like the information they gain, they join or they don't. And we meet a lot of people around town.
But you help them. You help
Absolutely.
them
Yes,
through
of
with
course,
everything.
of
So,
course, yes.
If anyone is
course.
interested, obviously these are the guys you're going to want to see. So, and obviously military life is not for everyone, but for those who want it, it's great. And if you get your college paid for, it's worth it. So, I mean,
Yes,
I'd
sir.
like to thank
sir.
you guys for coming on and obviously for serving our country. We appreciate it.
Thank you, sir.
Thank
Thank you for
Appreciate it.
having us. Thank you.
Thank you.
Thank you.
Stay tuned. We'll be back in a minute.
Hello, Clifton and friends. Welcome to the updates. I'm Sharon, and this year marks the 65th anniversary for Youth Week, and it's hosted by the Recreation Department. So please go to the website. Starts in May, and there's activities for everybody. Also, May 18th will be Relay for Life. Starts at 4 p.m. until 12 a.m. at Clifton Stadium. So please join them for a cure for cancer.
Hi everyone. The next spring rabies clinics for dogs and cats will be on Saturday, May 18th from 10 a.m. to 12 p.m. There will also be one on Wednesday, June 19th. And there will be one in Little Falls on Wednesday, May 29th. For more information about all of these clinics, you can contact the Clifton Health Department at 973-470-5760.
Thank you for your attention, and thanks for tuning in.
Okay, welcome back, everyone, and thank you, ladies, for the updates. Please, whatever the updates are, if there's something that you have to go to or volunteer or support, we'd like you to do that for the Clifton residents or any organization that we have. Tonight we have with us Melissa Allman, Senior Specialist, Advocacy and Government Relations for the Seeing Eye. Welcome, Melissa.
Thank you so
for
much.
coming on.
Thank you. It's a pleasure to be here.
Thank you. I have a couple questions I want to start out with, and that's, can you tell our viewers about the Seeing Eye mission?
Yes, I'd love to do that. The Seeing Eye mission is very important to me in particular, and other people who work with Seeing Eye dogs. We are about fostering and enhancing independence and dignity and self-confidence for people who are blind or have low vision, so that we can navigate our world and go about our daily lives as confidently as possible and independently as possible. That is what our mission is, and in order to do that, we train dogs to work with people who are blind all over North America, and we, of course, breed our own puppies in our breeding center, and we also have follow-up instruction for people if they need any support after they leave the Seeing Eye, after their 25-day training here. So we do a number of things, and it's all in support of that mission.
Okay, now moving forward, because I'm reading my questions, and I asked you before the show, you have it listed as a guide dog team. I'm assuming, I didn't know that. I thought, you walk around with 5, 6 people, but the person and the dog are considered a team. So
Yes.
Can you explain that just a little bit?
Absolutely. The handler and the dog are a team.
Okay.
Luna and I are partners. We are together 24/7. She guides me so that I safely get places, and I take care of her. I make sure that she's fed, that she has what she needs, that she's loved, and that she has the praise and positive reinforcement that she needs in order to feel like she is doing a good job. That is extremely important in the team. My job is to trust her, to trust her that she's going to get me where I need to go safely with the direction that I provide her, because I have to provide the direction, and she avoids the obstacles and gets us across streets safely.
Okay, and just to clarify this, because there's a lot of terms, service dog, guide dog. Just explain maybe the differences here, because so people at home would understand.
Yeah, I think that's a great question. So think of it as an umbrella. Okay, so a service dog is a dog that is individually trained to perform a task for a person with a disability. That can mean a lot of things. It could mean alerting someone that's about to have a seizure, retrieving objects for someone whose disability prevents them from doing that. In my case, it means guiding me. I'm blind, I cannot see, and so Luna's job is to guide me safely. And a guide dog, therefore, is a service dog. A Seeing Eye dog is a dog that is scientifically and specially bred by the Seeing Eye, trained by the Seeing Eye. It's one of our dogs. The Seeing Eye is a trademark. So we are the oldest guide dog school, and we are the only guide dog school that can call our dog Seeing Eye dogs in the United States.
Okay, great. Now, if I just well on personal note, before you had Luna, how do you go about getting a dog? If this is something you need in your life, how did you go about, is matching? How does this work?
Well, that's a really good question. I had to know enough about how to travel independently before getting Luna so that I could be eligible to receive a Seeing Eye dog. Obviously, you have to have a low enough visual acuity to be able to be eligible to have a Seeing Eye dog and to be able to successfully work with and trust the dog. So I had to submit an application to the Seeing Eye. They reviewed the application, determined that I was a good candidate for a Seeing Eye dog. They came to interview me, and that was part of the process of them making that determination. They wanted to see where I lived, what my environment was like, because it's very important to match a dog with the right person, the right dog with the right person. Yes. I spent 25 days at the Seeing Eye learning how to work with Luna. And the Seeing Eye flew me from Chicago to Morristown at their expense and back. I lived in Chicago when I got Luna, so I needed a dog that could deal with a lot of loud noises and busy traffic and hustle and a lot of people around. Some dogs are not suited to that, and some people aren't suited to that. So there's a lot that goes into the match. It's part science, part magic, a lot of moving parts.
Okay, and another question I have too, because if you're walking down the street or something, and people, especially little kids, and they see you with the dog, does that present a problem? What should they know about this when they encounter a guide dog team?
You've asked a really, really important question. Luna and I are a team. We're together 24/7. It's her job to guide me safely, following my directions about where to go, because I have to know where to go and she has to guide me. And I trust her, and she trusts me to be in charge. The problem is when people interfere with that team and that work that we do together to get around safely, it puts us in danger. So one of the things that I think is very important for the residents of Clifton to know, and everyone to understand, is that if you see a person working with their seeing eye dog or their guide dog, you know, maybe it's from another school, whatever the situation may be, just ignore the dog. Focus on the person. Luna is very cute, and she likes the fact that this is a little bit about her, right? And she would like it to have that attention, but it's very important to just see the person, ignore the dog, do not pet a dog while they are working with their handler, because it could put the handler in danger. If somebody calls to or talks to or tries to get Luna's attention while we're about to cross the street, I could not get across the street safely. Or if we're walking down the sidewalk and someone is distracting her, I could fall off the curb or run into something. So it's not because we want to be difficult or we don't want people to meet our dogs just for the sake of it. It's all about the safety of the team. So when that harness is on, when this harness that Luna is wearing is on, she is on duty. If the harness is off, then she's a regular dog, but it's still very important to ask the handler's permission.
Okay, because that's a good question, because I see that all the time on the streets, and I hope people are paying attention to this.
I love it when I hear kids, because there's a lot of education about this in schools now, and I walk down a street and I hear a child say, "Mommy, that's a service doggy, don't touch that doggy." And I think that's fantastic. Another thing is, please, please keep your pet dogs away from a guide dog team. It's very important because our dogs can be distracted by other dogs, and as much as you love your pets, there are times when you don't know how they're going to react. You don't know how they're going to behave. So that can sometimes result in encounters that are very unpleasant and could damage the working life of the team. So I would encourage you, if our dogs are working, they're not here to play, please keep yours away, is what I sort of like to tell people.
Okay, and that's great, perfect information. And now just back to the organization itself. How are our viewers, can they help the seeing eye?
Well, there are a number of ways that you can help the seeing eye. Educating the public about some of the things, other people around you, that I just told you is very, very important. Spreading this information is important. You can help the seeing eye by volunteering. We're always looking for volunteers. We have a lot that goes on at our campus. We have 20 to 24 students in a class at a time. We have 160 employees. It's a very big operation. So volunteers are helpful. You can apply to raise a puppy. We have 250 dogs at the Seeing Eye at the Washington Valley campus at any time. And obviously we have a lot of litters of puppies being born, and we need people to raise them to be good canine citizens and to have good house manners so that they can then be successful as seeing eye dogs, or that's part of what helps them be successful. And I will say that the reason I am here is because of people like you. I was at the Seeing Eye for 25 days. I was flown to Chicago and back when it was time for me to go home. I got instruction every day that was provided by very qualified and patient people. I got my very, very special girl here, Luna, and I got this harness that she's wearing, equipment, all of that for a tuition of only $150. It would not be possible without what we get in support from people like you, from foundations, from corporations. We don't get any government funding. So it's a gift. Luna's a gift, the Seeing Eye is a gift, and that's what you all can do to help us.
Okay, well, Melissa, and I'd like to thank you for coming on and sharing this. So Luna, I'd like to thank you too. I don't think she's looking at me, but it's
That's okay.
but thank you for coming on. I appreciate it.
Thank you so much.
Good luck with the dog too.
Thank you.
We'll be right back. Okay, well, that's our show for tonight. I'd like to thank everyone for tuning in. I'd like to thank all my guests for coming on the show tonight. We learned a lot of good information, especially the Clifton Health Assessment Program from the Board of Health. We learned a lot of great facts, and I hope some people get a copy of this or look into it. I'd like to thank my fabulous cast and crew for helping out tonight. Until next time, be good to your friends and family. Keep Clifton close to your heart. This is a great city. Thank you. God bless, and good night.